Thank you. It's a pleasure being here today, and thank you for inviting me to present my PhD project, Live Music Therapy with Lullaby Singing during Painful Procedures in Neonatal Care. And I'm getting there to the dissertation. I'm 1 year left, I think, about. So I'm close now. I'm doing this half-time, part-time. So it's been a couple of years that I've been living with this project now. I'm in a crossroad between music therapy, neonatal music therapy, medicine, neonatal pain management, psychological, developmental, psychologic, and neuroscience. So I'm in between there, and I pick and choose theoretical frameworks to explain what I see and how to help these infants coping with pain. Yes, as you can see, my name is Alexandra Ullsten, and I'm a PhD student at Örebro University. I'm also a music therapist at the Central Hospital in Karlstad in Värmland. So there is where I work. Just to give you a brief understanding of music therapy, is the professional use of music and its elements as an intervention in medical, educational, and everyday environments with individuals, groups, families, or communities who seek to optimize their quality of life and improve their physical, social, communicative, emotional, intellectual, and spiritual health and well-being. I work in a broad field. I would like you to meet a little fellow, Victor. He's the first patient I met in the neonatal intensive care unit in Karlstad in 2010. As you can see, he was extremely prematurely born in gestation week 24, and he had severely problems the first year of his life. His mother was deaf, and Victor, sadly enough, had visual impairment. So they had a difficulty in communicating. He spent 12 months in the Nicu in Karlstad, and I met him when he was 7 months old. And he was a very screaming child. He screamed all day long. And in that time, in 2010, the Nicu, the neonatal intensive care unit, was an old one, so they have open space where 10 or 15 infants were cared for in the same room. Then they built a new NICU in 2013, and that really changed the situation for all the families and all the babies, and for me as a neonatal music therapist, because then they had family rooms, and the babies cared for with the parents all around the clock, 24/7, and there are intensive care unit for the severely damaged, the brain damaged babies and so on. But the family care for the baby and the staff is going into the family room, taking care of the baby there. So, but in this time he was staying in this huge room, and he was screaming, and he was an annoyance for all the other vulnerable infants. So I started working with him, and when I met Victor and his parents, the response was just beautiful. He stopped screaming, he started laughing, and he was giggling to the music I presented. And when I say music, this actually is not really music. It's a way of communicating. It's a communicative musicality I use with infant-directed speech and infant-directed singing to actually talk with the baby in a language that the baby, infant, understands. So I will show you a short clip. And here is 1 year old, and he is really interactive, and with music and music therapy, one can find abilities in an infant that no one really saw before. So I will show you this clip. he is so clever. He's actually conducting me in this music interaction. And in the beginning, Victor had some problems with attachment, and his parents also bonding to this little vulnerable child because he was near death so many times during the first year. So they really didn't think that he would survive. But through these musical interactions, the triad, the dyad, the mother and the infant and the father and the infant connected, and was a beautiful ending to this story. And he went home with his parents, and it was 7 years ago now. So, when I started 2010, I was the first and only music therapist in the Nordic countries with implementing music therapy in the neonatal intensive care unit. What I work with is the family-centered, developmentally supportive, individualized infant-directed communication. And it's also infant and parent-directed non-pharmacological comfort and coping strategies, because pain is an issue in the Nicu context. These vulnerable preterm babies are experiencing between 7 and 17 painful procedures per day. It's a lot. So they need help, and the parents need help to cope with pain. It's also a cross-cultural parent-infant psychotherapy with early social interaction. Neonatal music therapy is an evidence-based therapy. When we're talking about soundscaping here today, the sound environment in the Nicu, well, not anymore in Karlstad because we have these family rooms, but it used to be a very busy and very noisy environment. And I've been out in the world, in the United States and in Germany, and visiting NICUs there. And they still have these open rooms with 20 infants. It's like a Romanian orphanage almost. It's terrible to see all these lonely infants because they have different social welfare systems. So the parents are not really there all day. They are there as much as they can. But in the Swedish and the Nordic countries, the parents are at the baby's side. And music therapy is trying to mask. It's actually masking the noisy environment and turning into a social learning environment. But it's absolutely evidence-based therapy for the infant when concerns reduce stress and recovery from painful procedures. And for the parents, I work with both parties here, and it's about attachment and empower the parents to nurture their vulnerable preterm baby and sick ill-term baby too. It was not long ago that they performed surgeries in infants, newborn infants, without any analgesia. It continued for decades in the medical context until there was an article about Anand and Hickey that they wrote. They discovered that the infants, they feel and they perceive and they have a memory of pain. Before that, they didn't think that infants felt any pain. So there was a huge undertreatment of pain in infants. But neonates feel pain and they should receive relief. Otherwise, pain affects the nervous system, changing the very structure and physiology of the nervous system. Pain can cause medical complications and problems with sleep, feeding, self-regulation, and attachment. Pharmacological pain relief increases the risk for long-term neurological problems, and that is also a problem. So the infants need pain relief, but the pharmacological pain relief is dangerous for them. So pain is often undertreated in neonates. So there is a huge need for biopsychosocial, non-pharmacological pain relief. And in live infant-directed singing, is showing to be a potent factor in this part of the Nicu context. So what is infant-directed singing? Well, I have used in my project a lullaby style. The play style is something else, but the lullaby style is a cross-cultural emotional communication. The lullaby is a simple melody in a slow tempo. It should be performed with lengthened relative phrases to the whole song, and it's repetitive and soothing and calming and 3/4/6/8 rhythm. So what does this make for the children and the parent? Well, the risk for overstimulation is small. If you compare it with infant-directed speech, you heard with Victor here when I talked to him, yes, hello, come on, Victor. There's long, huge differences in my voices, big span. But in lullaby, you kind of tend to have your voice very flat, no arousal giving signals. So the risk for overstimulation is small. It reduces the impact of background noise, regulates dangerously high arousal levels and keeps them on a safer level. It's finely tuned to the age and affective state of the infant. You tune in to the infant state and modify your singing so it's always monitored attuned to the infant. It gives the infant a pleasant multisensory experience, and music and musical speech is a central part of the crucial interaction between caregivers and infants, enhancing attachment. So I investigated, when I started my work in 2010, I really read everything there was in this area, and I discovered that there is almost nothing done about pain and music therapy in infants. There is older children and grown-ups, there are a lot of studies, but when it comes to neonatal pain and music therapy as an elevation of pain management, there was scarce. There was a lot of music stimulating, like recorded music during painful procedures, but no study with live music therapy. So I conducted with these research collaborators a randomized controlled trial in Stockholm at the biggest Nicu we have in Sweden, in Danderyd. And we called the project Efficacy of Lullaby Singing During Procedural Pain in Preterm and Sick-Term Neonates. And what it is about is a venipuncture, it's a skin puncture, and it's acute pain. So it's not pain during a whole day or diaper change or whatever, but it's a skin-breaking procedure, and that is what I've been focusing on. It was a randomized intervention, so each infant acted as their own control. We used infant-directed singing, lullaby style, performed by a music therapist student to standardize the intervention. We measured physiological parameters, heart rate, saturation, respiratory rate. We assessed behavioral pain responses in the infants, and we made some interviews with parents and nurses. So the idea of the lullaby intervention was, before, during, and after the venipuncture, was to minimize distress, stimulation, and arousal, while maximizing trust, stability, and the infant's self-organizing capacities. So this is the way it looked in a flow chart, you could say. We had a baseline, and then we started singing. Then the control situation was quiet, and there was a lullaby intervention for 2.5 minutes. Then there was handling and venipuncture, still continue singing, and then post-needle stage with lullaby or standard care control silence, and then a baseline in the end. Usually, when researchers perform studies on neonates and pain globally, they use no pain alleviation at all. So whatever intervention you take into the situation, it will kind of give them significant results. It's unethical, I think. So in my project, they had standard care as a base, and that is facilitated tucking, holding the infant, and oral glucose. It's like sugar on the tongue, as standard care for every child. The first article was published in March last year, and I made a case study. I was interested in looking into 2 premature infants, a boy and a girl, and what did the music help? How did the music help them? Did it help them at all? So I performed a microanalysis, and the lullaby that was performed, well, it was a lullaby, but it was improvised in the moment together with the infant, you could say. I will show you a clip, and as I have transcribed the music that was performed by the music therapy student, I didn't sing in this, but I had a student singing. And while she is singing, you can see this boy is moving his hands. So let's show this clip. And watch carefully. Hands and melody contour. And now the lullaby begins. Yes. Did you see that it followed the contour of the melody? The hand, da 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 dum dum dum, and there was a rest. And the first part of this prelude, I've called it prelude. Now we're really microanalyzing this. Is on the second, every second here. But it's important because what the student did here unconsciously and not really by the protocol is that she's talking to the baby here with her voice, the prosody of the voice. And it's kind of arousing him because he's moving. In the pauses, in the rests here in the music, he kind of go into with the hands to his chest, and there's a typical reassuring gesture with infants. And when this melody starts, or this introduction starts again, he's out there following with his hand the contour of this improvised melody. But when the lullaby starts, he kind of comes to rest. So this is really something that I taught, that I learned to teach music therapists. If they are going to sing during, or the parents going to sing during a painful procedure, start with the lullaby at once, because it's soothing. The lullaby itself is repetitive and soothing, but this prelude before is kind of a a chit chat. It's like more an infant directed speech. It's like chatting to the baby, and hello, hi, I'm here, and who are you? And he's answering with his hands. So it's not an ideal situation, because the baby needs to calm down before the skin puncture is performed. So that is really important. And here you can see what is really happening. Infants are so fantastic human beings with an innate possibility to communicate with their different modalities, with the different senses. And here is actually a picture of the baby and his movements according to the contour of the melody, but his inside him, the physiology is also following the melody. So music is really physiological too. It's fantastic to see. And what is important here is the ability to integrate information from one sense, the hearing, to embodied information to another sense and transpose it to the hand. Is an example of this. And time and movement is like the synchronized hand dance to this improvised melody. This is just a prelude part. Another thing in the microanalysis was a nurse. How did the nurse talk to the infant during venipuncture, during the pain? How did she address the infant? And here is the girl in the standard care. This is without lullaby. And what happens is that she says like this: "Hey you, oh, do I really need to take another blood sample? That's a pity." She's using a prosody downwards, meaning this is hopeless. She's sending a message to the girl, this is hopeless. And she responds instantly. As you can see here, her heart rate goes down, it drops, and her respiratory rate too, to dangerously levels here. Saturation is not, thank God for that. But what happens is here that it's affect contagion. That is, that the nurse voice is sending a message of hopelessness. And the girl is picking that up instantly, and her body is reacting with a freeze position. I can see that in the video. She's freezing in her position. And after 30 seconds, she's moving again, but she's really freezing. And that is a response, defense response from human beings when there is a hopeless situation. We're not going to put infants in that situation. So, what's the result of the case study? And of course, it's 2 infants, but it's interesting to see in the bigger picture then later. So it's more stable and regular physiological patterns throughout the lullaby procedures compared to the standard ones. The nurses needed less time to achieve the required amount of blood during procedures with lullaby intervention, which included 1 skin puncture. That is really something we have to look into. The infant doesn't need to lay forever until they get the blood they needed. And the procedures with standard care only required 2 skin punctures and were twice as long. So conclusions. Live lullaby singing offered effective support for both infants. It decreased stress before and after the venipuncture, which is very important in painful situations. It is a communicative interaction which may optimize the homeostatic, the stabilizing mechanism inside the infant during painful procedures, if the vocal performance is predictable and fosters safety from the start of the singing. And you always have to monitor during singing the shift of the infant's mood and effects to really be supportive. And you have to be in a painful setting very careful with how you communicate and interact with vulnerable preterms. So your voice is not really giving more pain to the situation. This year I published the bigger picture. All infants in the efficacy of live lullaby singing during procedure pain in preterm and term neonates. And here, the 38 infants in the study was present. The lullaby was singing, as I said, by a student before, during, and after venipuncture. But here, we didn't see any significant pain alleviating effects of the live lullaby singing on the pain responses. However, there were no indications that the singing was harmful and stressful during venipuncture. So how can you really analyze this result? Well, music is a multimodal, multisensory intervention, and pain is a biopsychosocial and multisensory experience. And we are measuring with very inadequate, I would say, measurements, and analyzing with measurements that are not really, perhaps not really perceiving the possibilities in the music and in pain. And there was one significant calmer breathing pattern during lullaby singing before skin puncture. So this follows the microanalysis you can see in the bigger picture, but there you can see just as a trend of fewer and shorter skin punctures with lullaby support. I think if the parents had been singing lullaby for their infant in the situation, it might have been different results. Parents and infants are sharing in the same body or brain, you can say, in the beginning. So it would be interesting to actually investigate that. As Bowlby has said, if a community values its children, it must cherish their parents. I'm not going to be able to perform another RCT study within my project time, but it would be very interesting to dive into the pain alleviating potential of parental singing during painful procedure, empower parents to become more involved in effective procedural support through live singing. I think that is the key factor. The parents, if they are stable enough and want to do it, they are pain killers themselves, you could say. Thank you for listening. And if you want to look into pain and infants, PEARL, Pain in Early Life, is a network, research network that I'm part of, and it's on the web, and a lot of useful tips and knowledge about how to alleviate pain, not just in infants, but in children too. Thank you so much.
Thank you, Alexandra Ullsten. This was a fantastic presentation, really. Anybody who has comment? Yes, I see a few hands. Shall we start there? Right?
Thank you very much. That was very interesting to listen to. I was astonished to hear about those big rooms that the babies had to share with others. It sounds crazy. If you want to have a soundscape that is relaxing to a neonatal baby, I thought about sounds that the baby could hear in the mother's womb. Like heartbeat, breathing, blood rushing through their vein and so on. What's your thought about working with sounds like this also? Like white noise, trying to block out other noises that could have a stressful impact on the babies.
The problem with the sound environment for these infants is that it's depriving. It's not... you could say it's a lack of messages in the sounds that is meaningful for the infants. I'm not talking about Sweden. In Sweden, we have the parents present almost all the time, but in other countries, in the Nicus, the baby is alone almost all day and night. And the parents is perhaps visit 1 hour in the morning and 1 hour in the afternoon. And they are deprived of communication because the language skills are actually starting already in the womb, but then it continues, and you have to actually talk to an infant in a way that the infant understands, oh, it's me you're talking to. It's a way of using your voice and your prosody. But all these sounds and white noise, well, perhaps it's masking the noise, but it's not really directing your communication to the infant, so the infant can learn and share their feelings and intention with some human being interested in just this baby.
But could I just ask, is that something that they need all the time? I mean, if they're like premature, does they need like a company of something that's not stressful? Maybe they don't need someone to talk to them all the
Now,
time.
I understand what you mean, but in the womb, someone is talking all the time, and you hear the heartbeat and so on. Yes, you can play heartbeats, but are you sure that it's the mother's heartbeat? If you want to use heartbeats, use the mother's heartbeat. But you can't just take any heartbeat and think that is significant to the baby. And these premature infants, they need, it's actually one study made or several studies that show that it's too silent in the NICUs. Well, there's a lot of noise, but it's also very silent because no one is communicating. And communicating is not just talking or singing, it's holding, touching, multi-sensory ways of communicating there are, I'm sure. You understand that? So it's a way of embracing the human being in communication in different levels. Of course, not to overstimulate, but not understimulate the infant either.
There was one more, yeah.
Well, there is some scientists researching in cognition that they think that the first thing the Homo sapiens did was to sing, not to talk. And I got was thinking about that when I saw this little baby's reaction. What do you think about that? Results?
I wish I was there in those times. But anyway, some scientists says that music is an ordinary auditory cheesecake, is not important for our evolution. On the other hand, we still have this ability, singing, musicking. So I think it's really important for our evolution. It's another way of communicating. If that was the first thing we did, I have no idea. But the research shows that the infant is so capable when it's born. Even premature infants are capable of communicating. As you saw here, this boy, he's communicating with his hands, and they are so ready, and there's an innate knowledge about perceiving pitch and melody contours and all these things. So it's very important for us human beings to have this, proto-conversations. It's a pre-verbal, it's like it's laying out a foundation for speech later on. So it's important.
I was thinking when at the Child and Noise Symposium, I think we were talking about that the mothers singing during the pregnancy, in connection with what you were mentioning, that the child and the mother had once been the same organism before birth, which surely gives a relationship of a kind that is very unique. But I was wondering if there's been any studies of men singing lullabies for children, if that would do anything good at all.
It's interesting. Since we in Sweden or the Nordic countries have the situations where the parents are present, I wish we had more studies including the fathers. They're coming more and more, the fathers, into this research. But in globally research, they are just mothers. But what they have in one study, as I remember, investigated was the mother's voice, a female stranger voice, and the father's voice. And this was a little bit older infants. And female stranger voice was more interesting for these older infants than the mothers and the fathers. So father comes on third place or so, one could say. But he is important because he is a support for the mother, not even more important for the preterm infant, where the father has the preterm infant on his chest, kangaroo sitting. So the father is so important.
Yeah, but there were no studies on that.
No, not so many anyway.
No. Okay, there's a lot of things to do. Any more? Yeah.
May I interject, because I recall having read a study exactly on this topic. I don't think I've dreamt it. It was a study where about the ability of the unborn or the fetus of recognizing strangers. So a bit the same setup where you have, of course, you have the mother's voice, you have a stranger female, you have the father's voice, and I believe you also had a stranger or a range of unknown male voices. And then the behavioral reactions in the fetus unborn was being measured in terms of kicking and activities, and the it was a significant effect on the fetus recognizing the father's voice when speaking. So I can't recall the authors, but as I said, I don't think I dreamt this. This study existed. Yeah.
I'm sure, because he's also there in the sound environment outside the womb. So I'm sure
enormous variation about how present the father is.
Exactly. But the importance here is to start communicating with the infant early during pregnancy, because the infant knows the prosody of the mother and the parents and the siblings and the dogs and the music preferred in the family. You know, it's all there. So separation is no good. Keep the parties together in the Nicu.
Yeah, that'll have to be the last word.
I think
there's one more. Right, two more.
Yeah.
Okay.
Thank you very much for your presentation. And I was wondering about this. How much is it communicated to the nurses? To what extent their communication with the children has such an impact on the child, as we could see on your research here?
There are different nurses. We have the nurses, and we have the assistant nurses. The assistant nurses, also undersköterskor, barnsköterskor here in Sweden, they are actually having the role to be social with the baby, to hold the baby during painful procedures and talk with the parents about social things. And the nurses, head nurses, they are taking care of the pain procedure and the pills and so on, pain medicament. So the social part of the nurses, they are very concerned about this, how they use their voice and how they talk to the infant. I was just going to say the fathers also use this infant-directed speech. They raise their voices too. So it's a universal language, how to speak with infants. The other nurses that performed here with this example, she was not aware of her voice. So it differs. It's a work to do for me as a music therapist in a good way, to role model how to talk with infants, and you help the parents to talk with the infants.
Yeah, Aneta?
In fact, I have two questions. In the study where you showed that you have 38 infants, do you know what type of voice the nurse used for your control? I guess that you looked at it, for the controls that you had without the lullaby singing. Do you know what I mean? If the voice of the nurse talking to the child during the control injections could influence positively.
I didn't macro-analyze 38 infants. I micro-analyzed 2 infants. It's a huge work. So I don't know how they spoke to the other, let's say, 36 infants. But since I was there in every single venipuncture during this year, I could hear both the positive voices and the negative voices, of course.
Okay, last question.
Yeah, last question. You showed an amazing example of Victor. I'm just thinking, have you done any study focusing on the music therapy, on calming infants as such? Because I'm just thinking there was a dramatic and so, easily visible effect of it. Have you tried to write about it or summarize it in your scientific papers?
Well, there is a huge research foundation about calming infants with music. So, in less crying, pain reduction, calming down, saturation raises, heartbeats goes down. So there's a lot of research out there. So I don't have to do that again.